Hi, my name is Guy-Anne Prue, and I'm a physiotherapist in the Cardiac Rehab program. Thank you for joining us today for the Cardiovascular Rehabilitation Virtual Group Education Series. You will be gathering as a group to explore various topics relating to heart-healthy living. These sessions will provide you with information, but also hopefully a chance to learn from each other. In today's session, we will be talking about getting started with exercise. As this is your first session, I will go over this disclaimer. The information presented in this session is not a substitute for, nor does it replace professional medical advice that you receive. And of course, if you are feeling unwell, please seek medical advice, follow up with your doctors, or if urgent, call 911. In today's session, I will start by explaining the difference between physical activity, exercise, and talking about the various types of exercise. I will then stress the importance of proper warm-up and cool-down. The remainder of the session will be spent reviewing how to determine if you are exercising at the right level. All of the information that will be reviewed today can be found in your physical activity guide. You should have been given the links to these guides by your mentor or case manager, the person who did your initial assessment when you got started with the program. However, in case you're not sure how to find it, I will show this to you now. It is found on the Heart Institute website. So from the Heart Institute website homepage, go to Patients and Visitors, and then Tools and Resources. Near the bottom, you will find the Cardiac Rehabilitation Guides. The first one is the Physical Activity Guide that we are referring to today. You need to press the Download Cardiac Rehab Guide, and then it'll open up a PDF or a book-like version of the guide. Going back, the other guides can be found, and you can just click on the download button and they will open automatically. Let us first define some key terms regarding physical activity, active living, and exercise. Physical activity refers to all of the activities that burn more calories than sitting still. So that would be when you're doing your house chores, when you're doing groceries, that type of thing. It is all helpful for your heart health, but it is different from exercise. Active living means that you are making conscious decisions to move more every day. You are potentially standing up when you are talking on the phone, or going to the mailbox every day instead of only once a week, or maybe you're doing the stairs more if you tolerate them. Physical fitness is the ability to have enough energy to do all the things you want and need to do. When we talk about exercise, we're talking about planned, structured, repetitive activities to improve and maintain one of the aspects or components of physical fitness. And those are your cardiovascular endurance, that is helped most by doing aerobic exercise. So that's your heart, your lungs, and your muscles working together. Your flexibility through stretching, your muscle strength through resistance exercise, and your balance through specific exercises designed to help that particular skill. All of these are important, but for heart health, we encourage you to focus on aerobic exercise first. Before we move away from this slide, I want to highlight some of the main benefits of exercise, as thinking about these and your personal reasons for exercise is crucial to help with motivation to exercise long term. Exercise helps in managing many of the risk factors for heart disease, including decreasing blood pressure, blood sugar, as well as improving your cholesterol. However, exercise has many other benefits, including making you feel better, both physically and emotionally, helping you gain energy to be able to do all the things you want and need to do, to have less difficulty with these daily activities, to reduce stress and anxiety, sleep better, and feel more confident and in control. Let's just define aerobic exercise. Aerobic exercise challenges the heart, the lungs, and the muscles to improve their function. To be considered aerobic, an activity has to increase the heart rate for at least 10 minutes. This would require activities that use large muscle groups and are continuous in nature. Walking can be aerobic, it depends how you do it. We are looking for a moderate intensity, a pace that is slightly more than your strolling pace, and that you can maintain for at least 10 minutes. So examples of what would not be as aerobic would be things like grocery shopping, because it's too stop-start to get your heart going. Doing stairs is another example. This would get your heart rate up, but most of us don't do stairs without stopping for 10 minutes at a time. So it's still valuable that you're doing stairs in a day. And as you get older, if you don't do stairs regularly, you may lose that ability to do the stairs. But again, for most people, doing stairs up and down without stopping would be too challenging in intensity. In your activity guide on page 16, you will find the definition of aerobic exercise, as I just explained. You will also find the FIT acronym, which is the frequency, intensity, time, and type. Ideally, aerobic exercise should be done on most days of the week, and the target, if possible, is to try and reach 30 minutes of exercise per day. If you are just starting out, you will have to aim for much less than this. If time, endurance, or joint and muscle issues limit you, you may need to accumulate the 30 minutes per day in sessions of 10 minutes or more. The most important thing is to find an amount of exercise that you can do regularly. So therefore, we're trying to avoid doing a huge amount of exercise one day and then taking many days to recover. It is best to start with something that's much less than that, but be able to repeat it. So frequency is first, and then increase the time, the duration, and then last is the intensity. And if you are new to exercise, we recommend that you look at the activity guide for the planning your exercise section. This will help you to think about what you want to do for exercise, where you might want to do that exercise, as well as considering the reasons for your exercise and thinking about the barriers and finding ways around these. As I just mentioned, walking is a great choice for many people. No equipment or special skills are required, and the risk of injury is low. However, there are many other forms of aerobic exercise, and that can include using cardio equipment at home, like a treadmill or a stationary bicycle. It can be using aerobic exercise videos. It could be dancing, skating, cross-country skiing, cycling, swimming, just to name a few. In terms of the intensity, most participants should be aiming for a moderate intensity where you're exerting some effort, but you can still carry on a conversation. And if you are wondering about doing higher intensity exercise, we ask you to speak to your mentor about this. Warm up and cool down. This is something that we probably all know we should do, but not necessarily everyone does. When you have a heart condition, it becomes even more important to include a warm up and a cool down around your aerobic training period, and as well around your strength training. So the warm up, it includes any light exercise, usually a lighter version of your intended exercise. So if you're cycling, just start cycling a little bit slower and gradually increase over a period of 5 to 10 minutes. If you get angina, you may need a longer warm-up. So the warm-up is beneficial for many reasons. It will help to increase your heart rate and your blood pressure gradually. It will help to prepare your heart and your muscles for the exercise. It helps to reduce symptoms, including angina or palpitations, feeling irregular heartbeats, and it helps to prevent injuries. The cool down is equally important. And basically, you're just doing it in reverse. You're gradually decreasing the intensity of your exercise for about 5 to 10 minutes until your breathing pattern is back to normal. And it is also an ideal time to do some light stretching. And again, the reasons for the cool down is to bring down the body's systems, especially your heart rate and blood pressure, down gradually. It helps again to reduce the likelihood of having any symptoms. So again, the angina, the palpitations, or even feeling lightheaded. That's a common one if people don't include a gradual cool down. And of course, to help prevent injuries. Next, we will be talking about exercising at the right level. This means exercising at a level where you are getting the most benefit of the exercise while remaining safe. For many participants, this means exercising at a moderate intensity. And there are several ways to determine the intensity of your activities. These include the rating of perceived exertion, or RPE scale, the talk test, as well as taking your pulse. It is also important to avoid symptoms, and I will review these as well. One way to monitor how hard you are exercising is to give a rating of how hard do you find the exercise, how hard it is for you. And it can change from day to day. So for example, if you didn't sleep the night before, what usually felt a certain number might feel like a much harder effort today. So you want to choose a number that represents your overall level of effort and fatigue during your session, not just one part of your experience, such as your breathing or sore legs. For moderate intensity exercise, we usually recommend 12 to 15. Now, this may be adjusted by your mentor as well. So as you can see, the rating of perceived exertion starts by 6 and it goes to 20. So it's not a 0 to 10 scale. 6 is no exertion at all. It's like sitting in a chair. 20 is maximum. You could barely take another step. Obviously, we don't want you there. So as I said, we're looking for a little bit more than the light for most people. Although if you're starting out, it is okay to just start to work on increasing your time and stay in the light until you feel more confident. But usually 12 to 15, I know 12 doesn't have a descriptor, but you're basically looking at somewhat hard to hard. The talk test is a simple way to measure your exercise intensity. If you're doing moderate intensity activity, you will be breathing faster than when you're sitting still, but you should still be able to carry on a conversation. If you can sing, it means that you can increase your pace. However, if you're taking a breath every couple of words or syllables, it's time to slow down. If you're doing vigorous activity, then you may not be able to say more than a few words, but you should still be able to talk a little bit between, to say a word or two between your breaths. So the third way to monitor your exercise intensity is through heart rate or pulse. So I saved it for last because it is a skill that needs to be practiced. So taking your heart rate or pulse can be done manually, and I will show you how. So you want to do it in one of two places, either on your wrist or on your neck. And you want to use your fingers, not your thumb. Your thumb can lead to double counting. So if it is on your wrist, you want to do it on the palm side, and it is not in the middle. It is more towards your thumb. Now, depending on how you want to do it, you can either obviously be facing yourself. So you can either put your fingers like this, or you can wrap around. And you will need to practice how much pressure to put. If you put too light a pressure, then you'll only feel the skin. And if you put too heavy a pressure, you will stop it, just enough blood flow to lose the pulse part. So that's one place to take it on your wrist. If you're doing it on your wrist, you want to make sure to keep your hand in line with your arm. If you really bend it backwards, that's another way to lose the pulse part. If you're doing it on your neck, it is in a triangle between your jawline, where you swallow, and the muscle between your ear and your chest. So it's a little closer to where you swallow and higher than the midway point. So again, 2 fingers aim towards the back and the middle. And you want to make sure you're only on one side at a time. It is a sensitive area, so don't press too hard. So again, practice will help you to figure out how much pressure to put. So once you can feel it, that's more than half the battle, then you need to count it. So you will need to have a clock or a watch with a second hand or a stopwatch to be able to take your pulse. And then you need to count how many beats you feel. So a heart rate is always expressed in beats per minute. So at rest, you could do a longer count of 30 seconds or a minute. That would be the most accurate. However, for exercise, that doesn't work so well because you need to stop to be able to take your pulse. It's not easy to do. And if you are moving, it's going to be harder and probably unsafe, especially on equipment like a treadmill. or if you're cycling outside, you won't be able to do that. So you need to stop. And the moment that you stop, your heart rate will start to drop. And for a lot of people, it drops fairly quickly. So you will count how many beats you feel for 10 seconds and multiply by 6. And we usually recommend the first beat that you count it as 0 instead of 1. So when you multiply, you don't add too many beats. So when you will take it will be before you start your warm-up, and then you will take it during your exercise, at least before you start your cool down. You can check it more than once, but at least once before you start your cool down to know what's the maximum that it reached. And then we also encourage you to check it at the end of your cool down to see if you're getting back close to what you were at the beginning. So it may not go right back to what it was, but it should have dropped from the maximum that you reached. So again, to review, fingers, not the thumb, either on your wrist, closer to the thumb, or on your neck, and count how many beats you feel in 10 seconds, multiply by 6. And in your activity guide, you do have the cheat sheet for the math. Now, one thing that I want to mention is that many participants are on beta blockers, and beta blockers are medications such as metoprolol, bisoprolol, and less often used, but atenolol or sotalol. So if you've ever seen what your heart rate should be based on your age, you have to disregard this. As a starting point for most participants, we give you 20 to 40 beats over your resting heart rate, 20 to 40. So if you are, let's say, 60 beats at rest, that means that you're aiming for 80 to 100 for your exercise. And if you're not sure, we do encourage you to talk to your mentor about what your own target heart rate should be, because the amount of medication that you're on will determine what your heart rate should be. So again, if you are using equipment that gives you your heart rate, or you're using an activity tracker with a heart rate monitor, you can absolutely still use it to check your heart rate, but you can't necessarily go by the targets that they set for your age. And that means that if you are looking at the zones, they often talk about the fat burning zone, the aerobic zone, things will be skewed a little bit if you're on these medications. So you should not be aiming for those. And as well, even if you're not on those medications, when you're starting out, we still want you to stay at a more conservative level and then build your way up. So again, talk to your mentor about what is the right level for you. So a note about these heart rate monitors, there's many different types. The majority these days are actually a heart rate monitor paired with an activity tracker. And they're typically a watch. And so the reading is done through the wrist. And they're a great tool to use, but we do want to remind you that they're not necessarily 100% perfect. And they have, the higher the heart rate goes, they can have a little bit more difficulty taking the pulse accurately, especially if you have an irregular pulse. So if you have something like atrial fibrillation, it may not be as accurate. So I'm telling you this so that if you do see numbers that don't make any sense, don't panic. It may very well be that it is an error in the reading, especially if you're feeling 100% fine. The other type of heart rate monitor that exists is one with a chest strap. And then you can see the heart rate either on a watch or sometimes paired with your smartphone. The ones with the chest strap are a little bit more accurate than the wrist worn ones, but I'm sure over time these will catch up as well. So how do you know if you're exercising too hard? So these are some of the signs of overexertion. So we talked about the talk test. So being unable to exercise and talk at the same time. Prolonged fatigue. So if it's normal to be tired after exercise, especially when you're not used to it, but we don't want you to be exhausted. If you can't do anything the rest of the day, you can't do anything the next day, then that is too much and you need to scale it back, even if you feel fine while you're doing it. Continued muscle and joint soreness. So of course, especially if you are starting, we want to make sure that you are finding a level in a volume that your body can tolerate, not just from the heart, but the rest of your body as well. And then these other signs that I'll mention are maybe potentially a little bit more heart related. So if you feel lightheaded, again, it's not uncommon to feel lightheaded because of the medications that many of you are on that adjust your blood pressure. So when you're changing positions, that's not pleasant, but can not necessarily unexpected. However, if you're feeling that lightheadedness on effort alone, that can certainly be a sign that you're pushing too hard. If you feel nausea coming on, if you feel pounding in your head, if you feel faint, weak, uncoordinated, and as I mentioned previously, if you have a heart rate that won't settle after a proper cool down, that might be a sign that you've pushed too hard. So again, it may not be right back down to what it was, but at least a drop from the maximum that it reached. Now, other abnormal responses to exercise are, of course, if you get any discomfort that could potentially be angina or heart pain. So to review, heart pain can be felt in many different areas, so not just the traditional left-sided chest pain. It can be throughout your chest. It can be in the shoulders, in the arms, left more than right, but it could be both, your upper abdomen, your upper back, and it could go the opposite way into your throat, jaw, teeth. And of course, if you get more than lightheaded to feeling truly dizzy or faint, and if you have palpitations, feeling your heart racing or skipping beats, so more than just an increase in the heart rate, because that's normal, but if you really feel that it's fluttering in your chest or it's skipping beats. So of course, if you have any symptoms like that, don't try and push through them, stop, rest. If it goes away easily, then maybe you can resume your exercise, but just at a slower pace. However, if it doesn't pass, and especially if it's severe, then of course seek medical attention. In terms of the angina, if you have nitro prescribed to you, if the discomfort doesn't go away after 5 minutes, then that's when you would take 1 shot of nitro under your tongue. Just remember that it's good to prime your nitro spray, meaning that you do a little spray in the air before you put it under your tongue to make sure you get a full spray. And usually it's recommended to do only 1 spray at a time, wait 5 minutes, and then spray again. So if after 2 sprays you have no relief, then that's when you call 911 and you can take a 3rd spray while waiting for help. And don't forget that if you're going to take the nitro spray, you should be sitting down in case you get lightheaded. Any exercise is great. So if you haven't done any exercise yet, if you're just starting out, we want you to start slow and do seek out advice from your mentor to help figure out what kind of exercise is the best for you, you know, especially if walking is more difficult for you. And again, do start with a small amount and move forward from there. I also want to point out that beyond the structured exercise, we encourage you to avoid prolonged sitting and find ways to move more. There's something that happens in our arteries after about 20 to 30 minutes of sitting. So just the fact that you get up and move, it doesn't have to be aerobic or vigorous at that point. It really is just movement, maybe some stretching for 2 minutes and then sit back down, sets back the clock in terms of what's happening with our arteries. So again, avoiding the prolonged sitting, finding ways to move, and strategies for that can be to, you know, park further from the store, as I mentioned before, getting the mail more often, walking around while you're on the phone, potentially dancing around your home. Some people may need to put reminders on their phone just to get away from, you know, computer work. So one last thing, I've mentioned it throughout this presentation, but when I mentioned the word mentor, it is your contact person. And this is the person who did, for most of you, will be the person who did your initial assessment. And these people will help you to individualize your program, answer your questions. By all means, do reach out to them. And if you're not sure who your mentor is, then reach out to our main cardiac rehab number. And I want to take this time to thank you for your attention and hope that this was helpful. Have a great day.